And that takes us to the mindset number three, which I had trouble putting it into words, and the closest thing I got to was a strong GPS or a strong compass. A GPS is formed by your sense of location, where are you in space, a sense of self, and your destination, where are you heading to, your sense of direction. And that is very strong in billionaires. I love Oprah's quote that says, when people tell me I'm full of myself, I say, thank you, that's a compliment. Because when I'm full, I'm overflowing and I have more to give. That is a lady who knows who she is, who knows, has a strong sense of self. As an example of strong sense of purpose, I got this quote from Sir Richard Branson. A passionate belief in your business and personal objectives can make all the difference between success and failure. If you aren't proud of what you're doing, why should anybody else be? And this is a recurrent topic in those different books I talked to you about. One of the differences, some of the differences between highly successful people and regular people are a clear center, a sense of self. Highly successful people tend to have high self esteem. That leads to them trusting themselves, trusting their instinct and gut feelings. A clear sense of direction. I was surprised to learn that the majority of high earners actually believe in doing what you love. These are people who know what they want and are passionate about a cause. And you may argue, not really. Some of them are not really following a cause. They just want money. And then I'll answer, well, that's their cause. That's their cause. Their purpose, they know what they want. They want money. And they go for it with purpose. So you may say, wait a minute, when do we draw the line? Where do we draw the line between that and selfishness and narcissism? And yes, you could say that some of the people we mentioned today could kind of go to that end. And yet, we physicians, especially female physicians, males not that much, tend to go to the other extreme of self neglect, self effacing, and a low sense of self worth. And that is something that is extremely important for you to pay attention to. This is probably the second most important thing I'm going to tell you today, but I need to make you aware of this very dangerous pattern. Are you ready? We physicians learn to disconnect and dissociate from our bodies. Think about it. We are trained to work through pain. We work through self deprivation, hunger, illness, pain. Before COVID, I used to put on a mask and go to work with the flu. I went to work through chemo, feeling sicker than some of my patients. Most of my clients laugh when I mention the example. How many times have you had a full bladder and be dying to go to the bathroom, but you hold it in because until you finish your work, you're not going to give yourself permission to go? This is not normal and it's not healthy. And that becomes worse over the years if we get burnout. Because, as you may remember, one of the dimensions of burnout is depersonalization, where we become dissociated in a way similar to what PTSD patients do. Some people say burnout is a form of PTSD. All that puts us at a very high risk of living on autopilot. And the younger you are as a physician, the more you can say, no, that's not true. I have a strong purpose and a strong direction. But beware that sometimes that purpose of, I will just survive until my graduation, if you're just surviving day by day, sleep deprived on autopilot, you are at risk of bringing that to your life after graduation. And after we graduate from fellowships and residencies, and we no longer have that sense of automatic direction of where to go. If we are not careful, that is taken over by bosses, Medicare, insurance companies, and suddenly we are on autopilot following everybody else's rules. So I invite you today to reflect on how, if you could benefit from bringing more self direction and sense of self to your life. Are you neglecting your own health and well being? Are you modeling a lifestyle you'd be proud of teaching your patients? Most physicians I know don't take the time to exercise or eat healthy or drink water or sleep. Do you have clear goals and a strong sense of direction? Do you know exactly where you'd like to be in 2, 5, and 10 years? In summary of mindset number 3, the billionaire mind is anchored on a strong sense of self, high self-esteem, sense of self-worth, and therefore knows what they want. They can have a clear sense of direction. We physicians have learned to disconnect from our bodies, to dissociate. We are also trained to be selfless and self-sacrifice, neglect our own needs. Therefore, we easily lose direction of what we want, what our needs are. And in extreme cases, that leads to living on autopilot, learned hopelessness, and blind obedience. In summary, the 3 mindsets I want you to watch for are hypervigilance, rigid linear thinking, self neglect, and dissociation. And I encourage you to work on them by working on that different positive mindset. How can you become more tolerant for risks and more accepting of your own mistakes? Can you cultivate a more expansive, flexible thinking? Can you clarify what you want and get a strong sense of self and direction? I encourage you to figure out your values and cultivate those values, the values of self compassion, playfulness, openness, flexibility, self awareness, intentionality, living with intention. How can we do that? Can we retrain our brains to tolerate risk? Can we learn to see errors as part of the learning process rather than shame generating events? Be more flexible and open and more in tune with our bodies? Yes, we can. And I'm going to share a couple of tools to work on that.